Thanks so much for joining. This is Celeste with OCH. Nice to see so many people already on the call. It's still a couple of minutes before 11 o'clock, so we'll give it a few more moments before we jump in.
Yeah. Evaluate that stage. Yeah, no problem. Let me out, count me.
One of the strongest bands and family people that has been made over the years that are pretty well known for is that not so many around.
Well, thanks everybody for being here. This is Celeste Schoenthaler with Olympic Community of Health. Really appreciate that you've taken some time to express some interest in this funding opportunity and to take some time to learn a little bit more about it and ask some questions. I did want to clarify, and I think Zoom probably pinged you about this as you were signing in, but we are recording this session. So we will be making it available on the FAQ page probably sometime tomorrow. And then we will also go ahead and put all of the questions and answers on the FAQ document from today's session, and that'll probably take us a couple of days to get those all uploaded. So I've posted the URL a couple of times in the chat. olympicch.org/funding is the place to be. So the plan for this morning's time is I will go through the application documents, and I'll do that pretty quickly. And then really this is time for you all to ask questions. And if I'm not able to provide a concrete answer today, I will, if there's something that we need to think on a little bit or something that requires a little bit more time, we will honor getting those responses up on the FAQ page just as soon as we can. People are still popping in here. Okay, So this is the primary landing page for the funding opportunity, and then there's links here to the 4 associated documents. So I'll go through these one by one, and we'll start with the overview and instructions document. And if you'd like to introduce yourself to the others who are here today, please go ahead and do that in the chat. I don't think we have enough time to go around and do introductions, but it's really nice to see so many familiar names and some new names as well. So the overview and instructions document is the place that really introduces the funding opportunity and outlines the requirements and the process. So for those who know Olympic Community of Health, we are the accountable community of health for the Kitsap, Clallam, and Jefferson counties. And we also are fortunate to partner with the 7 sovereign tribal nations in the region. And our overarching goal as an organization is to improve individual and population health and advance equity by addressing the determinants of health. And you can read a little bit about our history here, a link to our 2022 to 2026 strategic plan, which outlines these 4 focus areas that guide the work at OCH. So after our board of directors approved a new strategic plan at the end of 2021, we spent time in 2022 convening partners to dig a little bit deeper. So the strategic plan identified these 4 focus areas, but didn't quite get to the level of fleshing those out. So at the end of 2022, our board adopted 4 action plans, 1 for each of these focus areas, and they're linked here. So once you click on those links, you can learn a little bit more about the focus areas, including the regional actions we've committed to taking between now and 2026, the indicators that we'll use to track progress on those action plans, and the populations of emphasis that we'll aim to collaborate with for improved health. So you'll notice that the action plans have several actions under each plan, and our board did further prioritize those actions to a smaller slate at the end of 2022 so that we could have a really focused set of actions for 2023 and 2024. So there have been a couple of questions that have come in so far about what about this other action that's in the action plan. And while we do intend to implement each of those actions in some way over the next 4 years, we have narrowed those down a little bit for this funding opportunity and for 2023 and 2024. And that process is outlined a little bit more here. So there are 6 project areas that are open under this funding opportunity. The first is about reducing stigma of substance use disorder. The second is about availability of long-term and safe transitional and respite housing options. Embedding substance use disorder services and mobile units and jail programs. Partnering with hospitals to ensure access to respite, supportive, transitional, and long-term housing for people who are transitioning out of care. And then these last 2 are about the health-serving workforce. So identifying and implementing creative workforce approaches and partnering with schools and colleges to create pipelines and pathways. So the funding opportunity has these different deliverables. So the first is that we are requiring direct collaboration with at least 1 other organization or tribe from within the Olympic region. The funded partners will submit a mid-project report probably next February. And then there will be an optional regional convening of partners to share and learn. Also likely in February. And then we will ask you to submit a project completion report in November of 2024. And then probably in the spring of 24, OCH, a couple of OCH staff would like to come out and connect with funded partners. We're not calling that a site visit, we are calling it a project review visit. And then at the conclusion of the projects, all partners will be invited to present to peers and the OCH Board of Directors in January of 2025. Eligibility for the funding opportunity is open to organizations, tribes, and governmental entities who are in the Olympic region, and you are working in any way to advance health through collaborative action. The OCH will provide these supports and maybe more, depending on what is desired and of interest by partners. We will help connect to relevant resources and supports, facilitate connections, and provide any technical assistance. Funding for this opportunity, at this time, the board has allocated $2 million for the funding opportunity, and the implementation timeline is probably right around July or whenever contracts are fully executed through November of 2024. Funds, the contracts will be incentive-based, meaning that we will pay you, I think we decided 3 different times throughout the funding period, and you don't have to submit us invoices, you don't have to show us how the funds were utilized, and I will go through that timeline here in just a moment. As I've mentioned before, each application will include at least 2 organizations and/or tribes from the region, and there is not an explicit funding cap for the applications. We are asking folks to submit a reasonable funding amount in your applications, commensurate with the number of partners involved, the number of and scope of projects proposed, and the estimated number of people who would be reached through the project. Proposals with multiple partners that demonstrate high impact will be considered for higher dollar awards. However, our intention here is to fund multiple projects throughout the region. Requests for projects over $250,000 will be considered. However, these and other projects may be partially funded even if they receive a high score. So the timeline, we released the funding opportunity actually a couple of days before April 3rd. We have today this information session. The FAQ has been updated throughout and will be through the end of the application process. Applications are due by the end of the day, May 1st, and then the review period is most of May. And then the OCH Board of Directors will make final funding decisions at their June 12th board meeting, and we will notify applicants a couple of days after that, and then we will start contract negotiations. And that first payment will be made once there is a fully executed contract in place. As I mentioned, the implementation period is July or whenever contract execution happens through November of 2024. The site visit is spring of 2024. The mid-project report and then the second payment will happen in February of 2024. The final report and final payment will happen in December of 2024, and then the presentation to the board in January of 2025. It feels kind of crazy to be talking about 2025, but here we are. This is the scoring rubric for the funding opportunity. Each application will be reviewed by a minimum of 3 reviewers, including 1 OCH staff member, 1 member of the subcommittee that is leading this effort, and 1 regional partner. And if we've reached out to a lot of people about participating in the review process, and that does not stop you from being able to submit your own application. We have a pretty tidy conflict of interest procedure so that everyone can participate in the way that they would like. Staff will conduct a technical review to make sure that the applications include all of the required information. And then this is the scoring rubric. So there is a total of 55 points available for each application, 10 points for the element of partnership, 10 points for the budget, the scope, and the scale, 10 points for the description of the selected project, 10 points for equity, 10 points for implementation, and 5 points for sustainability. So I've talked a little bit about this already. So the board will make their funding decisions on June 12th. And in addition to considering the score of a project, the committee and the board will also aim to fund a variety of projects. We'll consider principles of equity in our final funding decisions. So things like funding big organizations and small organizations, and ensuring that we're funding projects throughout the region, and all of those types of things. So applications may be funded in full, partially, or not at all. You do not need to submit a budget as part of your application. This is kind of a repeat of what I've spoke about before, but I know that that is unique. It is different that you do not have to submit an application. There is a question about how much money you are asking and whether or not you have other sources of funding to support the project. In addition to today's information session, we do have an FAQ available online, and you are welcome to reach out to OCH@olympic.ch.org with any other questions, comments, feedback, and we will continue to update that FAQ document accordingly as we respond to questions. For those projects that will be funded and move to the contracting phase, we did want to make sure everyone is aware of some contract requirements ahead of time. So we will check for suspension and debarment and through the federal websites that make that available. In the contracting process, we will ask for a copy of your liability insurance, including general liability and automobile liability. We will ask you for a current W-9, and then we will be processing the payments electronically. So we will ask you to submit banking information to us as part of the contracting process. Applications are due just a smidge before midnight on May 1st. And the only element you need to submit is the completed application. I've mentioned the website already, and if you need an alternative to emailing us the application, please let us know ahead of time and we can make arrangements for that. So that's the overview and instructions. I'll quickly share this FAQ document just so you can know that it's there. We have been updating it as different questions have come in, so please take some time to peruse this. And we're happy to take any feedback about that process. And then the application itself is a fillable PDF form. You can respond by filling out this PDF, or you can use a Word document, a PowerPoint, any other format. We do ask that if you're going to use an alternative format that you include the question prompts and keep the questions in the same order so that folks who are reviewing the applications can flow through that seamlessly. If you are interested in submitting under more than one project, you would complete one application, so one of these forms per project. The application will ask you to name your project, so have some fun with that, and then indicate one of the project areas. Tell us a little bit about who is participating in the proposed project, keeping in mind that we need at least 2 organizations or tribes listed here. We ask you to tell us who makes up the project team, so list at least one contact for each partnering organization or tribe. These are the folks who will be involved in day-to-day implementation, who you'd like us to stay in communication with about the project, that sort of thing. And then the leadership team for the project are those people who would sign the contract, who are providing oversight and accountability, those types of activities. Under partnership, we'll ask you to describe the roles and responsibilities. And for all of these questions, keep it as simple and short as you can, while giving us enough information to be able to rate and review the project. Tell us if the project aligns or builds upon some existing priorities, or if it's new. Share the background as to how the project came to be. Describe how the partners have partnered in the past, or tell us about a new partnership. Describe the partnership approach, like how will the involved organizations and tribes work together, and how will collaboration support project success. Budget and scale, simply tell us the total amount you're asking for, any other sources of funding that you have to support the project if applicable, and then about how many people you expect to impact or reach through the project during the implementation period. The project description is what is the desired end result of the project, so keep that short and sweet. The current status of the project, especially if it's something that has had some history, provide some background to us. Implementation milestones, so those are those sort of key activities that not all of the details of everything that you'll do, but those major milestones. How will you measure success? The strengths of the project team, any challenges that you anticipate and how those can be mitigated. And then just a little bit about how the project will carry on in 2025 and beyond. And then we do have a section here if there's anything else that you think would be helpful to the reviewer. So perhaps there's a website or a video or a document you want to link to. We're happy to add those as part of the review process, and we ask here that you make it so that would take probably no more than 5 or 10 minutes of reading or watching for the reviewers. The final section is about equity, so we will ask you to check any and all of the boxes that apply here for the populations that you intend to reach through the project. How will members of those communities be engaged in the project? Describe the geographic area that you're planning to serve, and then any other ways your project will advance equity. And then the final section here is some attestation and commitments from the leadership team that you identified higher up in the application document. We'll ask those folks to add their signatures here for these elements. And then the final document that we included as part of this funding opportunity are some examples under each of the project areas. And this was intended solely to help get juices flowing or maybe to spark some ideas. These aren't indicative of what will be funded or what won't be funded, really just a way to kind of help support some creative thinking among the partners. So with that, I'm happy to jump into answering questions. And it looks like, Scott, I'm not sure where I said the word reasonable, so if you wouldn't mind clarifying where I mentioned that, and I'm happy to provide some more clarity about the word reasonable. And if we can give Scott a minute, and if anybody else wants to jump in with a question, either in the chat or turn yourself off mute, that would be great.
I think Scott posted that when you were talking about the amount of funding requested.
Yeah, so that's really the applicant's decision to make. So we will, going back to the application document, we are asking for the total budget, any other sources of funding, and how many people you expect to reach. So if you're sifting back over to the, I just have so many windows open. If you're sifting back over here to the rubric, this, it's 10 points here. The funding request is commensurate with the number of partners, the project, the estimated number of people to be reached, and that you've described any other funding sources. So I'm happy to answer any clarifying questions about that if needed. And if anybody else wants to jump in, go for it.
Celeste, hi, this is Mike. I just have a question about the budget portion. Is customarily, well, we're used to providing some kind of budget justification, something, some detail behind just a number. Is the committee looking for some kind of detail about what underlies the top line number?
No. You do not need to submit. A budget is not required as part of the application, and I know that that is hard, yet should be sort of fun to swallow. But historically, with the funding source of a lot of OCH's funding, we are not required to report that back up to a state funder. You know, if you feel compelled to tell us a little bit about how you came up with a number, you're welcome to do that, but it's not required to submit a budget. You also don't have to provide us with invoices. We will take the total amount you are awarded, divide it by 3, and pay you 3 times.
Okay, thank you.
Michelle Matheson, will there be a way to know which partners are doing which projects to connect with them during this pre-application process? So Michelle, if you're asking, like if you're looking for somebody to partner with on an application, maybe you can use today's session to share a little bit about what it is that you'd be interested in working on, and maybe you'll find a partner here. And you're also welcome to reach out to OCH. We haven't heard too much. People aren't really telling us what it is that they're proposing, but we'd be happy to try to facilitate some connections if we can. Jennifer Carr-Moss, JKM, go for it.
Hey, on question 21 for the equity categories, when you say people who are incarcerated, do you only mean actively incarcerated, or do you also mean formerly incarcerated?
We mean whatever it says. So this list of populations of emphasis came directly from the action plans that I spoke about at the beginning of the session. And so these were the populations that the groups who met last year identified.
Okay.
So maybe people who are coming out of incarceration could fit in one of these other buckets.
Okay. So then my same question was people in rural areas, you would assume that means literally in rural areas, is my guess.
Literally, yes.
Okay, thank you.
Question from Kim Hendrickson. The city of Paulsville, will applications favor that can reduce healthcare costs for people enrolled in Medicaid? So Kim, people who are on Medicaid is one of the populations of emphasis here. And as you know, I'm probably going to, I don't know why I can't quickly find that. There we go. I'm going to direct you back 1,000 times to the scoring rubric. So this is how the applications will be scored. In addition to final scores, you can read a little bit here about some of the other considerations we'll be making when it comes to final decisions. So reducing healthcare costs for people enrolled in Medicaid is not an additional consideration, although that's an opportunity for a population of emphasis. Tia would like to know if these funds can be used for construction, and the answer is yes. There is a question that did not go out to everyone, and Lillian, I see you also have your hand up. Is there a maximum amount of funds we can apply for? And if you have another part of your question, Lillian, I'm happy to take that. So the budget section is here. There is not a cap, except to say, you know, we did add this language. There was some discussion at our last board of directors meeting. you can review this language here, but proposals with multiple involved partners that demonstrate high impact could be considered for higher dollar awards. However, the intent is to seed multiple projects throughout the region. Requests for large amounts of funding over $250,000 will be considered. So the reason we don't have a funding cap is because we weren't sure how many different partners would come together. So if there's an application with 3 partners, that probably lends itself to, you know, $1 amount. And if there's a project with 6 or 7 or 8 partners, that lends itself to a different level of funding. So that's the reason why we did not put a funding cap in. And Lillian, did you want to ask anything else there?
No, that answers my question. Thank you. And how do we, or is there a way we can reach out to folk who, I see already some folk on the line that I'd like to perhaps have a conversation about partnership with. Is there a way we can get a copy of this or a link to get information about those persons? They're new to me. I don't know them yet.
Yeah, that's a good question. Yeah, I'm happy to do that. So when we post the recording of the session, probably tomorrow, we can list out the organizations that were on the call. And then if you want to reach out to the OCH at Olympic CH email address, we can help try to make some connections too.
Thank you.
And it looks like Michelle from Kitsap Medical Group is sharing what she's wanting to work on. And so if anybody is interested in working with Michelle, she posted her email address. Same with Nora, posted what they're interested in. Susan, so some good connections happening here already. Roy, did you want to pop off mute and share a little bit more about your question?
Yes, let me see here. Okay. Yes, do you hear me now?
Yes.
Okay, yeah, our organization is KC Help, and we are really a grassroots, all volunteer organization that serves all of Kitsap County, Silverdale, Bainbridge, Bremerton. And our partnership, if you will, is linked with almost everybody. But most frequently, we're linked with individual Knights of Columbus councils, although there is no religious connection with our organization. We accept, any denominations or non-denominations. And we work with all volunteers and parish administrators, hospitals, or people of need. So our purpose is fast approaching for relocation. And of course, we deal with hospitals. We've been in existence for more than 5 years, most prevalently during the pandemic, where many hospitals, HelpLink, and organizations no longer wish to service the need for durable medical equipment to people in the community free of charge. So our partnership, if you will, is with a very loose grassroots type of network. Would that type of partnership be acceptable?
Yeah, I mean, that all sounds reasonable. I think what I was coming back to as you were speaking, Roy, was whether or not the project and the work you're talking about fits within one of these 6 project areas. So I think that's another lens that you'd want to be looking at that under. Yeah. But I don't think there's, I think the types of partnership, the partnership that you're describing sounds like it fits with this.
Okay, yeah, the 2 areas would be launch and expand traditional housing programs for individuals transitioning out of hospital care. And also the second, a second would be partner with a faith-based organization to expand recovery housing options if recovery is deemed as being something that would be connected with durable medical equipment.
You know, that's actually a very good clarification for us to make, and I will add that to the FAQ, that when we talk about recovery, we are talking about recovery from substance use disorders there. So I will add that clarification to the FAQ.
Thank you very much.
Thank you for reminding me that there's lots of types of recovery. Joseph Reese asks if both partners need to be located in the Olympic region, and yes, they do. So I refer you back to the eligibility section that they need to be entities in the Olympic region. I mean, if they serve other areas as well, that's fine, but they do have to be an organization or a tribe that does work in the region. Kim is sharing a little bit about the project that she's wanting to do at the city of Paulsbo. And then Joseph has posted some more information, and Joe, it looks like I answered your question. Joseph, you still have your hand up. Is there another part of your question?
Yes. Can you hear me?
Yes.
Okay. First and foremost, good morning, everyone. Celeste, I really appreciate your concise and professional manner. My organization has just been established. It's a faith-based nonprofit called Mission Vision Ministries, and through an organic relationship as a general contractor, a house has been provided to me for a transitional housing. A model you'll be familiar with, a level 1 recovery residence, is Oxford House. However, mine is faith-based. I'll be volunteer living here at this residence. I can house up to 14 plus men. And I'm looking for partners. I fit many areas of this, and I'm looking to make a big impact on this community and help people out of homelessness and addiction, as people once helped me from a hopeless state of mind and body and homelessness to now being an active member of society. And that's what I'm looking to maybe replicate. So thank you for all this. The only question I have for you, Celeste, is this. You mentioned in your very detailed orientation is two things, insurance and a W-9. I'm unfamiliar with those things. And if there are key components, I need to get familiar with what those things are. And if I don't have them, how can I get them? And is there applications where they're not necessary? Those two things.
Thanks for sharing. Yeah.
Okay.
Gotcha. Thanks for sharing a little bit more about your organization and your work. And it looks like Kim is asking you a follow-up question. And if you want to post your contact information, that might be a good way for people to connect with you. So, in response to your question about providing us with proof of insurance and a W-9, so the W-9 is a federal document that we will send you, that you fill out and send us back, and that indicates like your tax ID. It, provides sort of like the official name and legal information about your organization, and then the same with insurance. So we would, I think most organizations are required to have some sort of general liability insurance, and we, it's upon us to request a copy of that, so that we make sure we're doing our due diligence, that everybody is on the up and up with those legalities.
Absolutely, and I have those things. Thank you.
Okay.
I don't have. All right.
Any other questions coming to mind right now?
Real quickly, Celeste, could you just reemphasize or go over the categories again? I think you mentioned there were 6, and just talk briefly about each one, just for a little bit more clarity.
Yeah, and Lillian, to make sure I'm following your question, are you talking about the 6 project areas?
Yes. Okay.
And you want me just to say a little bit more about them? I think the project example document might help. So we put a few, and this was just kind of quick and dirty work by the staff team here at OCH, where we outlined a few project ideas for each of the 6 project areas. So I don't know if that might help to better understand them, or if there's a specific question you have about one of the project areas, I'm happy to answer that. I don't know quite what else to say.
Yeah, well, if
without
you-
maybe a little more prompting from
Yeah.
you.
Okay. I just need, well, maybe you can help me get can I get a copy of the project examples? Where do I get that?
Yes, so it's linked. It's linked here on
Okay.
the funding webpage. And
Okay.
it's also in the, this is the overview and instructions document, and it's linked under the project goals area as well.
Okay. That's what
And I'm happy to copy and paste that link into the chat right now too, so you can have quick access to it.
Okay. Thank you.
And I'm still happy to provide additional clarification if there's another prompt you want to ask about any of them.
Well,
And then I think the other.
No, go ahead. I was really
I
specific.
was just going to say, I think these documents here that are linked in the first page of the overview and instructions, these are the different action plans. So these have a little bit more context about the focus area, the indicators, those types of things. So.
Okay. Yeah, I was just wanting some more discussion regarding the health equity portions. But I'll take a look because I didn't have the paper at hand. So I didn't know if I joined a bit late. I didn't know if you had mentioned something regarding that at all or not.
No, I think that the equity questions and the application start here. This is the application document, so it starts at page 6. We ask which populations you'll be reaching through the project, how those folks will be engaged in the project, where the geographic area of the project, and how will serving these communities advance equity. And then describe any other ways the project will advance equity. So those are the prompts we have about equity.
Could I ask a quick question of items that I'm thinking we don't need? We have it on file, but of course there's no need to clutter unless requested. And things such as the registration with the Secretary of State, the UBI number, the charitable organization, the IRS, qualifications. We'll keep that until requested. Am I correct on that?
Yes, yeah, we will check for all of that ourselves, and then in the contract, we only need from you the W-9 and the insurance on top of the contract. But we will check ourselves for your registration with the Secretary of State and all of those pieces. What else are folks wanting to ask about at this time?
Celeste, this is Janelle.
Hey, Janelle.
Hi. So when and if we work, well, not if, because there's a must, partner with other entities, do we all submit a W-9 then? And are we all singly paid, or is it just one entity that's paid?
Yeah, I avoided this conversation in the in the overview document because it was starting to get really unruly. So that is a conversation that we will have with you. So assuming assuming your application gets to that space, OCH will let you know that the project was funded, and then we'll talk with you about how you want that to flow, because we understand that you may not want to divide the money equally. So we'll have all of those kinds of conversations at the contracting phase. But I did have a section about that in here at one point, and it just started to get really long. So I decided to hold it for another day.
Oh,
but thanks for thinking ahead. Thanks for thinking ahead of it.
All right. Thank you.
I will say that anybody who's going to have a contract with OCH, they will need to provide a W-9 and insurance.
Another question for you, Celeste. This is Janelle. If you're already receiving funding or have received funding in the past, do you still need to submit those documentation?
You do, yeah, and thanks for asking that, Janelle. The reason is that we will be paying partners out of the actual OCH bank account for this project, and the other work that you do for us, we pay you out of a different banking system. So we need to have a new W-9 and a new copy of your insurance.
Perfect. Thank you.
Can you talk a little bit about the Medicaid nexus here and the funding source that provides the overall grant funds for this?
Yeah, so Alex, the easiest way for me to answer that is these are called Board of Director designated funds. So for those of you who might be familiar with OCH's history, we contracted with the Healthcare Authority for about 6 years under the Medicaid Transformation Project and earned incentives. And we didn't fully spend all of those dollars. And so some of the funds that we did not spend are being used to support this funding opportunity. So these are not funds that come to us from somebody else. These are funds that our board of directors set aside for the past 6 years so that we could do this kind of work. Which is part of the reason why we don't have to ask you for a lot of detailed information like you're used to. So. Looks like a couple more questions in the chat. Is there a partner? If there's a partner we are considering that does not have a relationship with OCH, would they need to submit their own application? Or do we submit a joint application? Do we, as the OCH partner, submit the application? So, this funding opportunity is really separate from other funding opportunities that OCH has put out there in the past. So this is sort of a fresh start, a way for both partners who have engaged with OCH in the past and those who haven't engaged with us to partner up on this work. So there really isn't anything to that. So it's one application per project, and that application needs to have at least 2 partners involved in it. It doesn't matter to us who actually presses send on the email. That's up to you all to decide. And this can come from brand new partners. This can come from partners who have been partnering with OCH for a long time, or a mix. We're open to any and all of that. And then what if a partner does not want to contract directly with OCH? Could one project partner manage the contract for all? Yes. Christina, that's part of how things were getting really complicated when I started writing this out in the document. So we will be sure to make that really clear in the contracting phase about how all of that will work, so that there can be one contract, there can be 2 contracts, there can be several contracts, and you all can decide how the money is going to be divided. The only rule is that anybody who does have a contract with us will need to not only sign the contract, but provide the W-9 and a copy of insurance. And I will say that I think, and I think others on the call might be able to add more to this, but I think OCH is pretty easy to contract with. It's a pretty simple template. The scope of work from the application will be a part of the contract, and then the deliverables that are mentioned pretty high up here in the document are what will be included. So a mid-project report, the optional regional convening, a final report, an in-person project review, and then presenting to the board of directors. That's really all the contract will have in terms of the scope of work. Anyone else wanting to jump in with questions or connections? Well, I'm happy to stay on the line for the next 10 minutes or so if anybody wants to ask other questions. So other than that, thanks again so much for expressing interest about this, and we hope to see your application roll in by May 1st. Have a great day, everybody. Thank you.
Celeste, this is Susan Britton with Sound Experience. This is a whole new direction for us, and I'm not sure if we're going to fit in with this grant, but I just want to double check. We've been working with 2 LGBTQ youth organizations in the area. We run the Schooner Adventurous, and basically we're working to, get them more comfortable with who they are, try to reduce drug addiction and depression and suicide. And we've run 2 years of programming called Gender Odyssey on the Salish Sea. And it involves accumulation to a 5-day overnight trip on the schooner. And I was wondering if this is the kind of grant that we would be able to, would be suitable for, or is this much more directed towards health organizations? I'm sorry, you must be muted.
My apologies. Which of the 6 funding opportunities were you feeling like that aligned with? Like these 6 project areas?
Yeah, so I'm looking at, whoops, let me find my, where are we? This is, sorry, I've lost which one. That was in, I apologize. This would be under page, in the Stronger Together Action Plan. Where would that be? This would be, so I'm looking with
so these on the web page, these are the 6 project areas.
Yeah,
and these
so
are also listed in the overview.
It would kind of fall under the partner with schools and colleges to create pathways to address local workforce shortages, but that's kind of very different than addressing it towards health workforce, isn't it?
Yeah, workforce is really the key here, like, because this falls under our action plan about increasing access to care. And one of the things that happened, yeah.
So no,
yeah.
it's
so I'm not
information gathering, and I might put the grant in and see what happens, but I just want to kind of get, because listening to it this more today, I realized this is much more directed towards housing and drug addiction and substance abuse, and or towards tribes and communities that they're suffering. So okay, well, thank you for answering my question there. That was really helpful.
Yeah, and best of luck to you. Thanks for the work you're doing out there.
Okay, great, thank you.
Anybody else who stayed on the line, were you interested in asking other questions or?
Hi, this is Gabby from Believe in
Hey, Gabby.
Recovery. Hi. I just had one question. Would this be able to, I guess, add on to the services that we already provide in our mobile unit and in our jail program?
Yeah, absolutely. In the, not this document, sorry. In the application document, you'll be asked to clarify if it's a current project, to provide us with the background. And then there's also a place like if you've partnered I knew it was going to happen at one point during this hour-long session that my dogs would go crazy. But how the proposed project aligns with or builds on existing priorities, or if it's new. So yeah, I think that would fit under here.
Okay, thank you.
Celeste, that's my
Mhm.
question. My question is very similar to that. I have a local STEM program at our community center and wanted to do some things that would partner with other organizations to create pathways to address local workforce shortages, particularly in healthcare. And so I just kind of wanted to get a feel if, and you answered the question, it's an ongoing program, but I want to, of course, build it, expand it, bring in partnership and really make it more meaningful. So would something like that fit into one of the 6 categories?
Yeah, it sounds like probably this one, if I'm hearing you right.
Yeah.
That identify and implement creative workforce approaches.
That one, and of course, the last one, partner with schools and colleges to create pathways to this. So within both of those.
Yeah, you
Ours-
would just pick one of, you would just
Pick
pick
one.
one for the sake of the application, but yeah,
Okay.
yeah, you're right. It could fit in either one of those. Yeah.
Thank you. Thank you for your
Mhm.
time.
Of course. Yeah. Good luck. Good luck. Anybody else who's still on the line here want to ask anything else or? Okay. Well, then
No,
we'll go
thanks
ahead
so
and
much.
end the. Yeah. Yeah. You're welcome. Best of luck with your application writing and thanks for your interest.
All right. Have a great day. Bye.
Appreciate your time.